to our collaborator today, Dr. Joseph Farmer, who is with us and will be presenting today's session. So Joe, when you're ready, please come in. The floor is yours, and thank you very much for being with us today.
Thank you, Michaela. Yeah, thank you so much for having me. Like Michaela mentioned, so my name's Joe, and so by day I'm a psychiatrist. So I work in the inpatient mental health wards here in Coventry, and by night I'm Batman. No, I'm involved in this health awareness project, Civility Saves Lives, and that's why I've been kind of invited here today to talk to you guys. So I like to quickly start with a bit of a disclaimer, because we're going to be talking about civility, incivility, behaviour, and often kind of more specifically rudeness, and when behaviour doesn't go as we want it to. And I don't want you guys to kind of panic to think, oh my goodness, why have we been invited to this meeting today? Is it because we've been seen as being the kind of the rotten eggs of the organisation? That's not what I've been told, so please don't worry. That's not the assumption I'm going on. Even if you consider yourself one of the kindest, most supportive people in your team, in your organization, what this will do, if nothing else, is give you the kind of evidence and the backing as to say why that's so important. So moving on, what is Civility Saves Lives? I mentioned we're a kind of health awareness project. Essentially, we're a collective of people that have come across information, amalgamated it hopefully in a way that makes sense, and trying to kind of spread the message, if you like, telling people about it, come into events like this and seeing who will listen to us. And we've done that across the UK, to various NHS organisations, also to some of the Royal Colleges, the GMC, the NMC. We've even taken this to Parliament. So hopefully you'll see over the next few slides the reasons why we think this is so important. Back in 2016, I was working as a second-year doctor, and at the time I was on an obs and gynae placement. I was allocated to a busy gynae theatre list that day, and we had a very big case first and then some smaller cases in the afternoon. Everyone was really keen not to get, too delayed or be too late finishing. And in particular, I could tell the consultant was very kind of keen to get going and not be too late. And we were starting the first procedure laparoscopically, so putting the camera ports in. It was being led by a very senior registrar. The consultant was there, and then I was also there assisting. And the senior registrar was just struggling to get the first port in, to get the camera in. And the consultant was getting a bit impatient and said, look, hurry up, what are you doing? And probably less than 30 seconds went past, sorry. And she was still struggling just to get this port in. And the consultant just said what's on the screens, which is, get out of the way. You clearly don't know what you're doing. Swap with me now. I'm not putting up with this all day. And it just kind of dropped like a bomb in the middle of that operating theatre. And I can remember thinking to myself, oh my goodness, this consultant's obviously having a bad day. I need to make sure I don't do anything wrong, just keep my head down, do what I need to do, get out, check my rota, make sure I'm not working with them anytime soon. But you could see it was playing on the minds of everyone in that room that day. Whenever that consultant looked up from the patient, made eye contact and asked for something or requested something, everyone was just a bit on edge, taking that little bit extra time, fumbling a bit or doing something slightly wrong and needing to go back and do it again. Things that these people had been doing thousands and thousands of times. Now, thankfully, nothing major went wrong that day. We kind of got out of those cases without any major issues. I checked my rota and I was like, oh, phew, I'm not working with that consultant anytime soon. And I didn't think anything more of it at the time until the next day when I was due to meet with a consultant I'd worked with in the past called Chris Turner. Now, he's someone who has quite an extensive background in human factors and how behaviours impact work. And he kind of asked me, oh, hey, Joe, how you doing, dude? In his classic Edinburgh accent that I'm not going to do an impression of for fear of, stepping over a certain line here as a Welshman. But he was one of these people who I could really open up to. And without kind of realizing it, before I knew it, I'd kind of dumped on him all that stuff I'd seen the day before. And he kind of reacted to it and was thinking about it. And he was like, it's interesting. I mean, it's bad, obviously, that happened, but it's interesting. He'd just been doing some reading of some research, looking at the impact of rudeness on kind of individual and team performance. And this was in an office place. And we got talking and we felt this kind of sense of responsibility. Neither of us could really leave it beyond that kind of brief discussion. And one thing led to another, and essentially coming out of that short conversation and experience, we felt that we wanted to kind of spread this information and tell as many people as we could. And that was where kind of Civility Saves Lives was born. And we're still talking about it over 9 years later now. So what am I here to talk about? So I've mentioned civility, but really what I want to kind of start thinking about is incivility. Now, when I'm referring to this in this context, what I'm meaning is this rude or unsociable speech or behavior. But a big thing about this is it is as interpreted by the other person. So that makes it quite difficult because we can't control how someone interprets or hears or experiences what we say or do. And so suddenly it becomes quite complicated. And you think, oh my goodness, how on earth can I say anything or do anything if someone's just going to kind of react in a way and just call me rude? And obviously that misses the point. And that's not what we're here to do. We're here to help people, but to do that, we've got to work with people. So we can't just not do or say anything when we're at work. So what instead I think we need to do is think about what this means. How might our speech or behavior be seen? How could we be interpreted or even misinterpreted? And when we start thinking about this, there are so many different examples of what could be seen as rude or unsociable. You know, right from the kind of simple, kind of subtle things like tutting or eye rolling when someone's speaking, dismissing someone's opinion, telling them don't be so stupid or get out of the way, you clearly don't know what you're doing, like in my example. There are so many different things, and obviously at the far end of all this is the more extreme examples where it's more targeted, repetitive bullying or harassing behaviors. But a big thing is probably we're all going to have slightly different versions of what we see or what we would consider as rude. So it's really important we start thinking about this when we consider how we approach this and what we do or start to do about it, because it can be really important. Now, when me and Chris were talking about this, and he was trying to kind of get to understanding what is going on when someone is rude, what is that impact? And the obvious thing is to think about how it affects us as that individual when we're on that receiving end of that horrible rudeness. It makes us feel sad. It makes us feel upset. We come away like this poor solemn boy, replaying it over in our minds, dwelling on it, ruminating on it even. What on earth just happened? Why did that person say that or do that? Was it something I said? Was it something I didn't say or didn't do? Am I the one being too sensitive? Am I the one not being resilient enough? And that impact in itself is huge. But I guess the question me and Chris were trying to think of was there something else going on? Or is there something else going on? And certainly we think there is. And one of the concepts I want to kind of talk about to try and start to consider this deeper impact is this concept of bandwidth. Now, on a good day, the average one of us in this meeting can sort of stay on top of and do well kind of 6 to 8 things. Now, that is our kind of bandwidth at the time. And that can be taken up by any number of things. It could be remembering on the way home from work, I've got to go to the shop to pick up stuff for dinner. Could be remembering to post my mum's birthday card before the last post again, and I miss it. I have to send her an apology message. But it could be to do with work. It could be checking in or checking up with a patient, looking for any changes in their presentation, speaking to a member of the MDT or sending a referral for an opinion. Any number of things can take up our bandwidth on that day. And when this rudeness occurs, this bandwidth starts to reduce. And rather than 6 to 8 things, suddenly it becomes 4 or 5 things. And if that rudeness is still going on, that person's still in front of us, maybe it's 3 or 4, 2 or 3, just one thing. That person becomes the only thing we can think about in that moment. And the way I think about this is if I've ever been in this situation, let's say outside of work, and I've really wanted to come up with that kind of quick response to kind of throw it back at them and be like, haha, take that. And I just can't, because that person has taken that ability away from me. They are dominating my bandwidth. They are making me stupider in that moment. And it's only an hour or two later when I'm in the car and my bandwidth is opening back up and I think, that would have been a great thing to say. But the moment's passed. It's too late. But it's important because in that hour or two or whatever it might be for our bandwidth to open up, and it's going to vary person to person, we may not be as good at doing those other things in the meantime as well. So it might be that I've started driving home and I've missed the shops. I've got to double back to get those things for dinner. Or it might be that I've realized I've just missed the last post and I've got to message my mum again and apologize. But it might mean that I've forgotten to follow up with that important thing for the patient or service user. Or it might be that I haven't sought that opinion or referral from the MDT for them. And suddenly there's this potential that delays or things get missed within patient care, how I do my job in that immediate aftermath. And this lined up with what Chris had been reading about, that research when we first spoke. And this was research done by a lady called Christine Porath. She was looking at the impact of rudeness in the office place in America. And the big finding that she found was that this 61% reduction in cognitive ability happened in that immediate aftermath of the rudeness. That huge reduction in bandwidth that occurs when rudeness happens at work. A massive reduction in our ability to do our jobs in that time period, which is huge. Now, add that to the fact that we're going to be feeling upset, replaying it over in our mind. This is a massive combinatory effect. That wasn't the only thing that Christine Porath found. There were lots of other issues or other impacts that this was having. And when you start to think about it, it makes sense. We're going to be worrying about that incident, playing it over in our mind, ruminating, dwelling on it. We're not going to want to deal with that person again. We're going to try and avoid them. If we can't avoid them in person because we're working closely with them, maybe we call in sick. If we call in sick and we're looking to come back, the problem or the issue is still going on, maybe I don't want to come back at all and I leave. Suddenly these negative costs and impacts are happening. And if I don't feel like anything's being done and I'm not being supported, then my commitment to work is going to reduce. Why should I give my best to my employer if they're not going to look after me or support me? My quality of work is going to reduce. And sometimes it may be unavoidable that if I've just faced some rudeness like this and it's weighing so heavily on my shoulders, the next person I turn to and speak to, I might offload on them and I might snap at them or be a little bit more likely to be rude to them. And it might pass on a bit like a kind of domino effect through our teams. And a bit like that, like throwing a rock into a pond, this kind of ripple effect actually spreads. So it doesn't just affect the person on the receiving end. It also affects anyone else that sees it. So this rudeness occurring between two other people, two other colleagues. And it's going to impact their performance too, with a 20% reduction. But there's this huge reduction in that willingness to help others. That kind of thought of, oh my goodness, if Joe's just faced that horrible rudeness, I don't want to be next. Keep my head down, do what I need to do, get out. I don't want to have to deal with anyone in particular, certainly not that person I've just seen being rude. Now, how on earth can we do the best in our teams in that setting where we're looking after patients or service users when we don't want to work with each other or help each other? It's going to have drastic impacts. Now, if that wasn't enough, the ripple effect kept going. And when Christine Porath was measuring this, obviously this was customers of those workplaces. But in our kind of line of work, this could be patients, carers, relatives, service users. That if they see rudeness going on between two members of staff, it doesn't have to be towards them. It's going to impact them. They're going to be hugely less enthusiastic for that organization, team, or service. They're going to be hugely more anxious when it comes to thinking about dealing with those people. If they can be rude to one another, what's stopping them being rude to me? Now, as an example, and I'm not saying either of these are rude or not, but if I was to say go into like tool station and I see two members of staff being rude to one another, I think, this is unpleasant, uncomfortable. I don't like this. I'm going to go somewhere else. I'm going to take my business somewhere else. And they lose a customer maybe, but I can just go across the business park to Screwfix and I'm no worse off. I just think, oh, I don't want to go there again. But if we think about how this might translate to our patients, carers, relatives, service users, where we might be the only point of contact for their physical health, mental health, or social needs, and they suddenly don't want to deal with us, then that might cause problems. Maybe they don't want to present to us when there's a new issue. Maybe they don't want to tell us when there's been a change to a problem or a change to their needs. They just think, oh, maybe that will get better. Maybe that will go away if I just don't say anything, because I don't want to have to go back and deal with those people because it was awkward last time. And maybe it starts to introduce delays. And maybe instead of dealing with the issue or problem sooner, we're dealing with it a couple of weeks down the line when things are a lot more difficult. And suddenly the potential for us to help might be impacted. All of these things kind of pool together and make us come to this kind of fairly straightforward conclusion that actually, with this in mind, we do have to consider our behavior. How is it going to impact team performance and individual performance of those around us if this happens at work? Now, apologies for the cheesy stock photo, but it's just to highlight this, that actually maybe we need to start thinking about this. How is it going to impact teamwork? How are we going to work best together when this kind of is going on? Do we think about it? And often when we think about what makes a good team, how do we work best as a team? We come up with similar things similarly and commonly. The whole kind of like well-oiled machine or fine-tuned watch analogy comes out regularly, where we're all these cogs in the machine. We've got a good leader, we've got good communication, we've got defined roles, we've got a clear defined goal, we've got the tools that we need to do it, and the right delegation of those responsibilities all working together. But do we need to think about something else within this? And do we need to consider or maybe learn from teams that do? Now, I want to talk about the New Zealand All Blacks, the rugby union international team for New Zealand. Now, I'm going to touch on this very briefly because rugby union is quite a sore point as a Welsh person at this moment, because we're on a very, very bad run. But enough about Wales. New Zealand, what do? So when they come and they put the shirt on and they train and they play for the All Blacks, they have a no asshole rule. Now, what that means is, simply, no matter who you are as an individual, no matter what your reputation is, no matter how much of a superstar you are, no matter how important you see yourself to that team, it is not about you. It is not about you or your ego, and you leave that at the door. Because if you come into that team and you're the asshole and you bring that ego and you make it about yourself, it detracts from the team performance. Now that kind of lines up with what we've kind of been thinking about from the kind of Christine Parth research. Maybe we then need to kind of apply this to our healthcare teams. Now, I'm not saying we go around saying, oh, don't be an asshole, you're an asshole, because that kind of misses the point. What I'm thinking of instead is, do we need to consider how our behavior may sit as this kind of key central cog within the kind of well-oiled, fine-tuned machine? And if our behavior isn't as it should be, how on earth can any of those other cogs function or work as well as we want them to? And maybe they can't. And maybe that's going to be one of the key things about how we consider how we move forward with this. Now, a lot of what I've been talking about so far has been based on the kind of research by Christine Parth in the office place in America. And one of the first things me and Chris wanted to try and do was understand, does this translate into healthcare? Is there any evidence or research that kind of mirrors or echoes or says something similar? And when we did our research search in 2016, there wasn't very much that came out. But there was one standout paper at the time, and it was this paper done by Riskin and Errors in 2015. And they looked at the impact of rudeness on team performance in a healthcare setting using neonatal resus scenarios. They split people up into teams of 4. They allocated them into either the control branch, which had someone in the background with a clipboard making neutral comments about how they're measuring team performance, what the scenario is, how they need to assess, diagnose, and intervene. So that was the control. And then they compared it to splitting those people into teams of 4, similar experience, similar makeup. But they had the same person or similar person at the back of that room with the clipboard, but this time making rude comments. Things like, we're measuring team performance across the world. What I've seen so far in this hospital's been really poor. I wouldn't want to get ill here. Here's the scenario. I need you to assess, diagnose, intervene, off you go. And then they paused halfway and said, how do you guys think you're doing? Because I don't think you're doing very well. I wouldn't want any of you on my team. Scenario's changing, you need to reassess, intervene, off you go. And they measured the kind of performances of these teams. And they found, as you might expect, why I'm talking about it now, where there was the presence of this rudeness, those teams performed poorer. Now, they quantified this. So they found that there was poorer communication and information sharing. They were slower to diagnosis, and there were more errors in the interventions. And when they kind of analysed what was contributing to this, they found that more than 50% of this difference was due to the presence of this rudeness. So it led them to that conclusion at the top of the screen. Teams cannot perform well in the presence of rudeness. This direct demonstration in the clinical setting, echoing what we suspected would be the case based off of Christian Parth's research. Now, since then, there have been thousands and thousands of publications in this area, which is amazing. Another one that's come out in 2019 by Katz and his team looked similarly, but this time at the kind of performance of anaesthetists in the presence of a polite or rude surgeon in this simulated operative crisis. And they found that where there was the polite surgeon, over 90% of those anaesthetists would perform into that expected level. Whereas where there was rudeness, less than 2/3 of those anaesthetists were able to meet those expected standards. So again, this negative impact on the performance of that individual when there was this rudeness directed to them. Now, Katz took it a step further and they asked all of those anaesthetists, how do you think you did? So can you subjectively score yourself against the same criteria? Now, almost all of them said, oh, I think I was meeting those standards, despite those numbers that were shown not to be objectively when there was the rudeness there. So it kind of shows, much like my experience when I was in that operating theatre, we're probably not very good at recognizing and acknowledging that impact when it happens until we start talking about it, until we start thinking about it, like now. So it's really important that we consider all of this. Because if we don't do something about it and we let this go on and we condone this rudeness or incivility in our teams, we're accepting poorer outcomes. We know now from the research that has been demonstrated the impacts that this is going to have. So we've got a responsibility, therefore, to consider how our actions and our words impact those around us. Because we need to know what we're doing as to whether it's going to be best for our patients and service users. Because I know, and I'm sure the rest of you in this meeting are here in healthcare and in social care because you want to do the best for those people that you look after. So if someone's saying, okay, well, maybe this is what's going to be stopping that, we need to consider this, right? It's difficult. And I assume that through me talking so far about rudeness and the impacts it might be having, chances are a lot of you have been thinking about situations or experiences that you've had. Now, it's probably because rudeness is pretty common, unfortunately, not just in health or social care, but in any place of work, in any walk of life. Now, trying to kind of consider what's going on, what might be contributing, what might push someone, if you like, from being a civil clinician, well-intended, kind, helpful, to an uncivil clinician. So I know there are times when I've been pushed into this moment and I've snapped at someone I didn't mean to. We're trying to consider what might be going on. Could it be that there's this combination of external stressors, stuff going on in our home life to do with our health, our family, our home, our finance, our transport, whatever it is, these things taking up our bandwidth that we can't just leave at home or leave at the door when we come to work. We carry them with us. And then if we come into work, which is a high pressure, high stress environment, which health and social care is, we're held against gold standards every time we see a patient or service user. And if we don't meet those expected high level standards, often it gets audited, reviewed, questioned. What's going on? Why were you performing poorly that day or with those people? That's a high enough pressure as it is. But then if we add potential extra stresses to that, like not having enough staff that day and having to do more than you normally would, or not having the resources you need to do your job to your best ability, and therefore maybe it adds delays or complications, whatever it might be. All of these things contributing to these kind of external stresses, taking up more and more of our bandwidth, pushing us that little bit more likely to snap. And then if we do in that moment, for whatever reason, and we don't do something, either to reflect on it on ourselves and try and do something about it individually, or to maybe approach that person and say, maybe that isn't the best way to do that. And we allow this to continue, where we become this kind of permissive environment that doesn't challenge it. Then it becomes easier for this to happen routinely. And a bit like working out at the gym, the more we're rude, the easier it is to be rude. We get good at it. It becomes our inbuilt response in a certain situation when we're in that kind of level pressure, or whatever it might be. It worked for me last time. The problem went away when I snapped at someone, so I'll do it again because that's what I need this time. And it becomes kind of perpetuated, and maybe it even becomes a reputation of an individual. And then if other people see it, maybe they think, oh, Joe's doing that, maybe I've got to do that because that's how I need to handle that situation. And maybe it becomes the way that that team behaves and becomes the reputation of that team or service. And suddenly it kind of spreads more and more and more. And it's really important. And the reason I'm talking about it like this is because what I don't want to do through this is to encourage everyone to kind of leave this meeting today and go, right, who are the rude people? Who are the ones with that reputation that we need to kind of lead that manhunt against, get our pitchforks and torches and go after them? Because that's not the point. What I'm trying to do is encourage that understanding or that perspective that actually it could be any one of us. And maybe we're just at different points in that process. And if we think about this and understand that actually, if I was in that situation or if they're in my situation, what is going on from either side, can we instead understand it? Can we consider? Can we discuss? Can we explore it instead of blaming and attacking? Because that is going to be the way that we kind of work through this in the best possible way. Now, one of the things that I want to just quickly kind of think about at this point is where there may be times where rudeness may occur or may be seen to be happening, but it may not be the intention. What might be going on that might contribute to how someone might be seen to be rude when they don't mean to be? Now, one of the first things I thought of was this communication method. Now, the more removed we are in our mode of communication, the easier it is to be rude, right? So, you see all the kind of keyboard warriors online being horrible when they're hiding behind their keyboards. Would they be rude to that person face to face? Don't know. But there's also more going on to this. And when we're talking in person, we've got lots of skills and tools that we can use to help that other person understand us or to help us convey ourselves in the way that we want to. We've got our verbal communication, the way and the tone and the kind of flow of it, how I say the words, the melody of it, the phrasing of it. But also adding to that is all the non-verbal stuff. My facial expressions, my gesticulations, my body language. I can see you, you can see me. If I see you kind of pull back or scrunch your face and I think, that probably doesn't come across the way I want it to, I can try again quickly. I can react and respond. We lose this the more removed we become. Over the phone, we still have the verbal stuff, the way I say it, but we lose the non-verbal stuff. You can't see me, I can't see you. So it becomes a little bit easier for us to misunderstand each other. And then obviously if we're communicating via an email, it's even harder because we lose the verbal stuff as well. And we're just left with the words. And it's hard. And I don't know if any of you have ever tried to be sarcastic in a group chat on WhatsApp or whatever. You send a message and I just think, oh no, that looks terrible. And then I'm sending another one to explain it and then another one, and I'm just digging a deeper and deeper hole. It takes so much more words to give the context than if we're talking in person. And sometimes we haven't got that time and we just send the line, it goes, and it looks too direct, too pushy, too passive aggressive. And if that other person sees it that way, that's the impact it's going to have. Now, this isn't even considering all those other nuances and things that we probably look at in an email and think, oh, what have they meant by that? Or they said warm regards last time and they just put their name this time. What does that mean? There's all these other things adding to how we may be kind of misunderstood with emails. It makes it more complicated. So, a couple of other sources of unintentional rudeness. Cultural differences can play a huge part in this. And I had a really good example of someone coming to me saying that they were from Mumbai in India and they were working as an A&E doctor, something they were very good at. And in A&E in Mumbai, if they needed something like a blood test for a patient, they would come out from the cubicle from seeing the person, they would go to one of the nurses and they would say, do bloods for cubicle 2. Nurse would do the bloods, they would start seeing the next person, they would come back, check the results, treat the patient. Now, they came over to the UK and obviously things worked very differently. First day, busy A&E department, they needed bloods for a patient, came out of the cubicle, went to the first nurse they saw, who was the nurse in charge, the nurse coordinator for the entire department, potentially the busiest person in the whole room. And they said, do bloods for cubicle 2. Now, you can probably imagine how that went. The nurse in charge essentially told them where to stick it. But they also said you could have at least said the magic word. Now, the doctor didn't know what that meant. They thought, maybe this is like a password because I'm new. They don't know I'm a member of staff and I've just got to kind of prove that I'm not just a random person asking for a blood test. It just didn't work. The nurse in charge left thinking the doctor was being rude. The doctor left thinking the nurse in charge was being difficult. They completely misunderstood one another. And there are so many examples of this where slight differences or nuances or variations in how we say or do something, varying between cultures. And that's even just considering that this is English spoken as a first language, but learnt in the UK versus learnt elsewhere. And this could even vary within the UK. Probably very different between how you guys may do it by default in Scotland versus how I might be used to in Wales versus how I've got to do it in England where I'm currently working versus even probably regionally within those areas. Then if we think about adding in trying to learn English as a second language on top of all of that and all the inconsistencies, all the kind of hidden meanings and all the kind of the things that we don't talk about and all those expected things we've got to go through in conversations that might just make it a little bit more likely that we misunderstand one another. I'm not used to how you say that. I didn't like it. Vice versa. And now the difficulty with this is because, the NHS is very proudly probably one of the most diverse employers in the world. There isn't a couple of slides explaining all the different cultures and countries from all over the world and how we should work together. But instead, what I would encourage is to just get to know the people you work with if they are from a different country or culture. How do we find what's going to work best between us when we need something from each other or when we're working together? Because that's going to be where you find the success within this. And you might learn something interesting along the way. Now, the other thing I wanted to quickly mention is neurodivergence, and particularly autism and ADHD. Now, with autism, we know it's a spectrum. We know it affects everybody differently in different ways. But when we're assessing or identifying autism, we know that there are differences in the interpretation of verbal and non-verbal communication. There's expressed emotions, the body language of others and even themselves, the kind of hidden meanings between the lines, reading between the lines. What are we kind of meaning when we're not saying it? And it could also be that kind of lack of interest in small talk, or those niceties or nuances at the starts of conversations just might not be as important to that person. Why do I want to talk to you as like the eighth person today about the weather? We've been outside, you've been outside, I've been outside. We both know what's going on out there. It's not interesting to me. It's not important to me. Instead, I see this more as a transaction. I need something doing. You're the person that I know can do it, so I'm coming to you to ask for it. But from the other person's perspective, they might think, oh, they didn't ask me how I was. They didn't offer to make me a cup of tea. They knew it was my birthday yesterday. They didn't ask if I had a nice time. How rude. And another person might overhear and go, oh, yeah, they didn't do that for me either. That is rude. And suddenly this kind of reputation may develop when it's completely unintentional. Now, the chances are autism is a lot more common in our teams than we would probably be thinking, because we select for a lot of the positive traits of autism within healthcare and social care. Amazing attention to detail, information recall, creative problem solving and perspective, all of which add to that MDT. Are selected for throughout our kind of processes through university and onwards. And again, it's not about going here today through all the members of your team going, are you autistic? Are you autistic? But it's more about what's important to you, what's important to me. And when we come together and need something from each other, what's going to be the best way for us to do it on an individual basis? That's going to be how we can do that. And then if we think about ADHD, obviously is that there's the kind of difficulty waiting turns and that difference in short-term concentration and memory. We're in a busy MDT, we've got a big list of patients to discuss, and I know my person's quite far down, but I've got something really important to say. I'm really doing everything I can to try and remember what I need to say. Don't forget, don't forget, don't forget. I'm probably going to be able to hear half of what's going on in the first half, and certainly not contribute as well as I should. And then when my person comes up and I think, great, I need to say this now. I need to say it, and someone else is still talking, and I might just burst in or interrupt or talk over someone, and that might come across as rude. Or I might be trying to like shimmy people along because I'm desperate to say what I need. And it might not be the intention, but that might be how it comes across. So really it's about encouraging. that consideration, the compassion to think with curiosity, what could be going on? Why might this be the reason we see this kind of rudeness or perceived rudeness at that time? There are lots of other things that contribute to this. Gender, generational differences, lived experiences, worked experiences, previous experience with that individual, working relationship, all of these things that I don't have time to mention are going to be interplaying and kind of influencing how we see each other, all of which are worth us considering when we come to consider what is going on when we see this rudeness happening. Now, I want to briefly touch on the role of the leader and encourage every one of you to recognize that we all have a leadership role. No matter how official it is or kind of directly to do with our job title or whatever it is, within our jobs, we are leaders at certain points. So it's really important to consider then and asking ourselves, are we leading by good example or are we leading by bad example through our own behaviors and actions? Am I being rude and dismissive, setting that tone, setting that expectation that actually this is what I think is acceptable for those around me? Do I know the people that I work with, or am I just not interested? Am I going to be wanting to have those conversations to understand and explore when rudeness occurs? Will those people feel safe coming to me, or will they think, oh my goodness, Joe's the main culprit, so he's not going to want to talk about or try and do something about this kind of issue we're having at work? Or are we taking the flip side approach to this, and are we being the good leader as such, leading by good example through our own behaviors and actions, being kind, being compassionate, making the most of the people that are around us, knowing them, knowing their differences to us, and taking advantage of it. All of these things contribute to our differences in experience and expertise. If we know these, then we can draw on them and do better for our patients and our teams. And it's going to mean that if something goes wrong with our behavior and there is this incident of rudeness, we're going to be far more willing and wanting to talk about it, explore it, understand it, have those conversations to get to a point where we can move forward together. People are going to be far more wanting to bring that forward when they know that this is the ethos in my place of work. That compassionate leader is so important. Drawing people in, empowering them, helping them to do better. So I really want you to consider, what is your impact on the people around you? Do you lift people up or do you drag them down? Because that's a really important question when it comes to thinking about how all this feeds and pieces together. So I want to briefly talk about the kind of the potential next steps, because we haven't got time to kind of really get into it. But these are things that I want to consider that might help when there are these issues or incidences of rudeness or kind of problems with behavior at work. The first thing is that I'm really careful and conscious of is not wanting to tell you guys what to do. It's not about me saying, right, you know the information now, so you can leave this meeting and never be rude again. Or if you are, you need to do this or you need to do that. Don't be the asshole. Because that doesn't work. We all have a very strong sense of self. And instead, it's about how we motivate others around us to understand why we're thinking about this. A huge part of that is obviously the first half of this talk, which is the awareness, the information, the context, the importance as to why we then do the next bits. Now, this is going to be different to everybody. And if someone came to me and said, Joe, you're rude, I'm going to think, well, no, I'm not. Actually, I think I'm pretty kind, I'm pretty helpful. I don't want to listen to you. I don't believe you. I don't agree. Whereas if someone came to me and said, oh, Joe, actually, I don't think the way you did that or the way that you kind of approached that was possibly the best way, and it left that person feeling really upset, it's going to have a huge difference in how I respond to that. I'm going to be mortified. I'm going to think, well, actually, what can I do to help? How can I approach this? And how we kind of key into different people's motivations is really important. And it might be, if they can't respond to being told actually you're going to have a negative impact on the people around you, because the research says, is there other reasons that might motivate them? Is it to do with money and all the financial costs that go with when rudeness occurs in our places of work? Is it to do with the impact it might have on the reputation of our team or our service or our organization? What might it be? So if any of you guys want to take this forward and kind of look to do something about this in your place of work, it's really helpful to think about this before you do, because your approach is going to really matter. So I want to kind of split this up very briefly into what can I do and then what can we do. So what can I do? So obviously the big thing to do with all this is reflecting on our own behaviors. Can I recognize if there are times where I'm pushed into that corner and I snap? And can I understand what is happening in that moment and look to do something about it? Can I catch myself before it happens again? Or if I can't, can I go back to that person and apologize? Because if I can do that, and on the whole, in general, we're not very good at doing that. We're admitting we're wrong when we apologize, and it's difficult. But if we can do that and we can show that other person that we really mean it, it can be really restorative and reparative to all of those potential impacts that Christine Parth was talking about. Maybe just that little bit less wanting to avoid us or call in sick, maybe that little bit more likely to kind of want to help other people in that immediate aftermath. It can be really powerful if we can do this in the right way. It's not just, oh, I'm sorry, tick box done. You've got to be able to show that person that you mean it. And that's up to you guys. So I'll leave that one with you to think about. The other side of this is, what do I do if I see this happening at work? So I'm an observer or a bystander when this rudeness might be going on to someone else. Or it might be that I'm on the receiving end of this myself. And the active bystander approach is one way to do this. And this is translating over from the police service. And it gives us all the responsibility to step forward and say something if we see something going wrong. Now, in healthcare, this is potentially useful if we're seeing something inappropriate to do with behaviour. And this isn't active bystander training, but the way that that would work would be considering, how do I approach that situation? Is it safe for me to do it? Should I approach the person being rude? Should I approach the person on the receiving end? Should I do it now? Should I do it later? Or do I need to go to someone external, the kind of police of the situation? And that might be someone like a manager, or it could be someone outside of the team, like a freedom to speak up guardian. And the idea is, if we all have this responsibility to say something, we're going to be a little bit more likely to feel more able to step forward and do that. And if we do, someone else probably will. And slowly, if we start showing that person, in the hope that that's not intentional in what they're doing, but we're saying, look, actually, that's probably not the best way to do it, it might mean that they are a bit more likely to be able to then step away and reflect and think, okay, maybe I can do something different in that moment. We can start to chip away at that underlying workplace culture for the better. Now, a really important thing also to think about is how we support the positive side in all this. Foster this kindness, lift people up, like I mentioned earlier. Do we tell people when we see someone doing something excellent, I really like the way you just did that, I really like what you just said in that situation? Whether that be informally and just letting them know, or more formally, more kind of through a specific process that allows us to do that. And I think on one of the slides you showed earlier, Michaela, there was like a thank yous thing. So it might be something like that. These guys called Learning from Excellence talk about this a lot better than I do. So by all means, go away and Google them afterwards. But essentially what they say is, if we've got formal processes in place that allow us to identify when things are going really well and excellent, we can learn from it. And we can then extrapolate and apply that elsewhere and do better in other teams, which can be really amazing. It's not all doom and gloom. If we focus on the positive while being aware of the negative, then that can be really successful in terms of how we move together, in terms of our workplace culture. Now, the last bit, what do we do together? First step, kind of what we're doing today with a session like this, is raising that awareness, bringing the information forward, helping people understand. Do we do that in training? Do we do that in induction processes when people first join our organization, to say, look, this is where we stand on all this, and this is what we expect from you coming in. Let's work together on this. Let's do better together. Do we build it into supervision sessions, checking in? Have you had any issues with anything like this? Do you need any support with anything? What can we do? Or do we just need to kind of put things up like posters or emails or screensavers with the information to remind people? Keep it fresh, keep it alive. And when we're doing that and we're talking about it and we're considering it, we need a way to know when it isn't going as well. So we need processes to let us know, actually, there was a problem here, or I saw this, or this occurred the other day. But we need a few things in place for this to work. We need people that are going to be on the receiving end of this information, maybe civility champions, that are going to handle this appropriately. And I'm not going to worry that they're just going to take it, go to that person and say, oh, Joe said you were being rude, and then they're just going to come back to me and double down and make my life even worse. I need to have the sense of trust in that system, that psychological safety, that this person knows why I'm coming to them, and we're going to all be able to deal with it in the right way. And then when we're doing that, and we've got a system that works to do that, we then need a way to deal with it. And a cup of coffee intervention is one way of doing that. So I mentioned psychological safety. For those of you not familiar, essentially what this is a workplace culture that says that we can bring something back to our teams, whether that's feedback, good or bad, whether that's raising a concern, whether that's criticism, whether that's reporting an issue, in the knowledge that it's not going to be to look at it and think, right, who's to blame? It's going to be to look at it and think, right, how do we learn from this to do it better next time and prevent the same outcome? Hopefully we have that already around our incident reporting systems with our negative clinical outcomes or whatever it might be. But the question would be, would you feel the same using a system if it was for behaviour and reporting behaviours? If not, why not? What might those barriers be? Is it to do with the psychological safety around it? And that's something just to consider within your teams. So last thing, this potential intervention. So this cup of coffee conversation was an approach thought up and trialed by Gerald Hickson and his team in the Vanderbilt University. And what they did was they used this informal conversation around a reported incident in order to convey it as an observation back to the individual. So basically what that means is if someone lets us know, okay, there was a kind of rude incident yesterday, or I perceived someone to be rude, we go back to the person seen to be rude and we let them know informally and give them that feedback. And Gerald Hickson kind of frames it as giving them this professional gift of how we're impacting other people. We don't often get that. And if we're shown or we're told, actually, this is the negative impact that you might have had in that moment, and you left this person feeling upset, we leave it at that and we let that person consider what they can do about it. And it can be really powerful. And the kind of overview of how that conversation might go is fairly simple. We've got to agree, they've got to agree to meet with us. We've got to do it timely, usually within a week, but maybe not too soon, not too late. We check in with them. How are you? What's going on? Yeah, I'm fine. How are you? Yeah, but really, how are you? What's going on in your world? Let me in. Are there any external stressors that we can help with? Anything in your personal life we might be able to signpost to? Anything in work that maybe we can do something about? What might be contributing to that kind of evolution, if you like, of the kind of rudeness? Can we do something to reduce it? And then we let them know. We give them that professional gift, or by asking them, inviting them to bring it to us. What happened between you and this person yesterday? There's no judgment, there's no telling, there's no you were rude, go and apologize. If they can say, oh, actually, yeah, I probably didn't behave very well with that person, let me go and find them and we'll have a chat about it. Perfect. If they can't and think, I don't know what you're talking about, then we just land that information. We let them know, after you two spoke, that person was upset. And I know you would want to know. We're on the same team, and I just need you to have a think about this. Again, there's no telling. There's no you were rude, go and apologize. We let them be the ones to do it. And most people can respond to this. And when Gerald Hickson measured this over 10,000 of these conversations, found that after one, 60% of the people brought up responded and weren't seen to be rude again. Those that were had a second conversation, and even more responded. And it only left about 10% of people that couldn't, that needed those more formal disciplinary processes or HR, whatever it might be, to deal with it. That's a huge amount of people that could respond in a positive way if we do something quick and simple about it. So that's something to consider. To round off them, this is an advert from the 1950s of a doctor endorsing cigarettes. And if you went on the TB wards in the early 1950s, after the NHS was formed, they would come round on ward round and say, hello, sir, hello, madam. Could I ask, do you smoke? Oh, maybe you might think about taking it up. Because we know that it's a great way to open up those lungs and try and get rid of that nasty TB. And also helps you de-stress, because gosh, aren't you in an awful situation? Now, obviously, our approach has changed. And rather than encouraging or promoting smoking, we're now supporting the cessation of smoking. We know now all the horrible things that smoking does to our health. We're in a similar situation now when we think about the impacts of our behaviour on our team performances for our patients and our service users. In order to do the best for them, we need to do the best when it comes to our behaviour. And we've got that opportunity now to take this forward, reflect on it, build into what we do, and how we go kind of about ourselves in our day-to-day work. You guys have all become kind of inadvertent civility champions now. So congratulations. Now, here are some of my references, kind of a lot of the things that I've been talking about. A lot of that is on the website. So if you do want to go find it afterwards, please, by all means, go and have a little look. It's not monetized. I don't get anything from you guys going and checking on the website. So it's just a dumping ground for where I put all this information. So thank you so much for listening. Michaela, I think I've eaten a little bit into our question time, but hopefully there's still some time to talk at the end.
Thank you very much, Joe, for this so many insights, and also I love the interaction in the chat.